Today, we're diving into a roadmap for the future of medicine. If you all felt like we felt the limitations of current healthcare system, where your cardiologist doesn't talk to your therapist and neither of them understand your meditation practice, we are discussing a new white paper titled Toward an Integrative Healthcare Paradigm for Whole Person Healing. Today we have amazing Dr. Nelson Valena. Thank you for joining us and thank you for your time.
Thank you, Reem. Thank you for inviting me. And I'm excited to chat because I think it's an important topic for all of us in healthcare.
Yes.
And it's a
Yes.
transition that's happening in the world.
Yep, and I'm glad to be part of that. So, in a traditional clinical setting, we look for the absence of disease. This paper suggests we look for dynamic balance. So, in your practice, how do you distinguish between a patient who's merely symptom free and the one who's actually coherent or resilient, as the paper mentioned, across their physical and emotional realms?
Yeah, let me go back a little bit and explain to you like why I thought it was important to have
Mhm.
something like this. So this paper is actually something that I've been working on, I would say for the last 5 to 7 years. I
Wow.
was in traditional medicine for a very long time. For over 25 years, I was doing mostly neurorehabilitation in a very traditional setting at the hospitals. But there was a point in 2011 where I actually had a stroke, and it led me to a whole different path in thinking about why that actually happened to me. Sometimes they say that you need some type of crisis or
Mhm.
something that
Yes.
totally makes you reevaluate life. And that was the point for me. It was the turning point. And what happened was that I thought I was doing everything right in medicine. I'm the typical doctor that you would think in terms of I work hard. I was ingrained that I'm supposed to push and persist and make things happen and be this rational mind and always using my logic and my brain. And I did all of that. But yet, this thing, which was a physical thing for me, this stroke, actually blew up everything that I thought I knew or felt was my own reality. And so I went into this phase of just reevaluating everything. And part of that was reevaluating what I was doing in terms of my career. And one of the things that really was brought out to me was something was out of alignment. Something was, this happened to me because it was trying to tell me something to make changes in my life. So when I started delving into that, I started realizing that a lot of times when we're in the medical field, we often focus mainly on the physical world. Or what in that quantum physics, and once you start delving into this, they call it the dense energy. It's our
Mm.
physical reality that we can touch, feel, and measure. But when you start looking
Mm.
at some of the ancient traditions, you start learning about what they call the energy, the energetic world, the metaphysical world, the things that you can't touch or feel that somehow affect our life and our bodies and our physiology. So when I started delving into that, I thought, oh my gosh, we and as a whole in the Western model in terms of allopathic medicine, is that we're missing a whole world in regards to looking at what are these influences that are affecting the information that's being given to our physiology. So
Oh, yeah.
all these ancient traditions basically knew that. And when you start looking at some of the methods and the rituals and ceremonies, you begin to realize that they were focusing on modifying the non physical world in order to heal the physical world.
The physical. Yeah.
Yes. So the white paper basically is my idea. And to be truthful, I use AI and I put down all of the things that I thought had to be in a healthcare system and that was important. And this was the compilation and synthesis of
Mm.
all of it. And I thought, wow, truly, this is the way we should try to move and transition our healthcare system to be more holistic and inclusive of the physical world, the dense energy, as well as the subtle energy or spiritual energetic.
I agree. I was talking to Jill before we came online, and she explained everything she does with fascia, trauma
Mhm.
release, and everything, and the energy and like the vibration. I'm like, why don't physicians know that? Like, why don't they teach them that in school? Because I feel like if when you give medication, you just modify the symptoms, but you don't heal anything. But when you go to the root and do all of that work, it's going to take time, but you're going to get there.
I totally agree with that. And it's a concept of the difference between curing and healing. So, curing is really basically most of what we do in what the traditional setting in regards to taking care of the symptoms. When somebody comes
Yeah.
to us and they're complaining of some type of symptoms, or if it's not only the symptoms, it becomes maybe a chronic disease, then we want to target our treatment and our modalities to taking care of that specific symptom. But oftentimes we don't trace it back to say, hey, how did this happen in the first place? What was the initiating factors that led to this physical dense energy? So, one of the things that I discovered in exploring these ancient healing methods is that energetically, there is, how would you say it, maybe a blueprint, a hologram.
Hmm.
And it's when we are healthy, we have a specific blueprint that is giving information to our physical bodies,
Yeah.
the the most optimal information, and therefore we don't have symptoms when that is the case, when there's no distortion in that information. And some people call it the biofield. Some other
Yes.
names for it
I read
is the
that.
auric field. So there's this information that's out there
Excuse me.
that gives information to our bodies. And if it's not in alignment or there's distortions, ultimately it would result in symptoms and disease. And so a lot of our root
Mm.
causes, I would say, can stem from the psychospiritual world, meaning that it takes a long time before that can manifest itself in the physical world. So there's
Yes, as a symptom. Yeah.
exactly. And you've heard, I'm sure, of all the things about ACE studies, that childhood traumas affecting,
Oh, yeah.
affecting our adult physical bodies, and it results in disease. And that's exactly right, because what happens in their childhood traumas is that because of those specific events, it causes a distortion in our psychospiritual, our way
Yes.
of thinking, our belief systems about ourselves. And ultimately, if those things are not corrected or changed to a more healthier version, it could result in chronic symptoms and disease, whether it's pain, whether it's cancer, or autoimmune disorders.
That's true. The paper also suggests that unresolved trauma, as you mentioned, undermines high order spiritual or cognitive functioning. So, do you see biological roadblocks in patients where their nervous system state actually prevents them from responding to traditional treatment and modern medicine approach?
Yes, absolutely. One of the things that I really honed in on is the importance of our nervous system, because when you think about it, how the spiritual world interacts with our physical bodies is through the avatar of our actual physical bodies. And within our
Mhm.
physical body is the nervous system, our endocrine system, our immune system. And so what
Yes.
happens is that if our physical bodies is in a protective mode, we understand this from all of the studies from heart math, from the studies
Yeah.
of polyvagal theory with Dr. Stephen Porges, that if you're in that fight flight, that sympathetic state, that oftentimes it prevents us from activating the repair and regenerate and the healing responses. So many of us, as we know, are in this constant state of fight, flight, and fear. in constant stress. And therefore, it is very challenging for us on a daily basis to really reset our nervous system and allow those repair and regenerate mechanisms to occur. And that's why we have so many people now that have chronic diseases, and so many people, what did they say, 40% of Americans have anxiety?
I think it's
Yeah,
higher.
all of us have anxiety,
Yeah.
right? Because it's so
Everyone.
challenging.
I've never seen anyone who doesn't have anxiety.
Exactly. Or they, at least they, many, some people may not admit it. And you know what's interesting is myself, what happened with the stroke was I never considered myself an anxious person. And when I had the stroke and then I started delving into these things, I realized that I cope with my anxiety with distractions. And one of the things that I do, and I'm sure many of the physicians and healthcare practitioners do it the same, is I use my work and I use the distraction of really, I was like a workaholic as a distraction to really tune into my feelings and my emotions. And what I realized that when I slowed down was that, oh my gosh, I have so much anxiety that I feel like I
Yeah.
always have to keep going. I have to fill my time up and so on. And it becomes,
So you don't think of whatever, like, yeah.
yeah, and we don't even know it. And we operate through life this
Yes.
way. And many of us physicians just do it and push and do. And I took pride in that. Actually, when I was working full time and I was in multiple hospital settings and so on, I always took pride in that I was the one that took the call, that I was the one that said yes to everybody, and everyone encouraged me to do that. And they're like, oh, thank you, and so on. And then when I had the stroke, I was like, oh my gosh, who's making me do this? Like, why am I killing myself? And I realized that there was something internal that basically pushed me to do that. And it was time to really reevaluate, was that for my highest good? Or is there something that I need to do to change myself in regards to really evaluating why am I doing these things and why am I pushing myself to the point that I have a stroke?
We always think of like this awakening happens after a big life event. And I think that's what happened with you,
Yes.
right? Yeah. Also, the framework suggested a collaborative.
So that is the question, right? When you look at our healthcare system today, basically, I think that the challenge is that we're all operating in, we're disconnected. We're operating in parallel tracks. So we have the allopathic model, which is the Western model. And then we have the holistic, or some people call it complementary, alternative
Mhm.
medicine. And so there's people doing it in that track. And there's not many opportunities where there's truly integration. And I'm I'm an advocate of what they call integrative medicine, which is really
Yes.
taking both allopathic medicine and more of the holistic or complementary modalities and then bridging them and putting them all together. So the problem right now is our system does not really support, especially financially, the other system, which is more of the holistic track. And a lot of this care is done out of pocket. And that becomes a challenge because as we get sicker and our cost of healthcare goes up, there's the insurance companies, the hospitals, and really the government make a lot of the rules of what is paid, what is considered standard of care, and what's going to be reimbursed. And so a lot of times, if it's not considered standard of care or traditional medicine, it is there's no funding for it. So people go outside the system to get this care. And what you're finding, and there's statistics now that indicate even up to 60 to 70% of the people now, especially after COVID and so on, are looking outside the system for more of this holistic natural remedies.
That's true. Yeah.
Yeah.
The thing is, I feel like we need to redefine medicine.
Yes. Yes.
and has like a big umbrella, and everything comes under it that can heal and cure the person, because you can't have just one modality. That doesn't.
And it's this concept of holism. So when
Yes.
you're looking at allopathic medicine or traditional medical system, you're looking at the difference between what they call reductionism
Mm.
versus holism, and you could also talk about what they call vitalism. So the reduction model means that you focus on organ systems and you have
Mhm.
specialists that look at those particular organ systems and optimize it, but they don't necessarily look at how does that affect everything else and also
Wow.
what the root causes are. However, when you look at more of the holistic or what they call the complementary or the ancient tracks, they often include more of the root causes and how does that affect, or a change in that organ system or system affect the other systems. Now you can also think about, they have something called functional medicine now, right? Medicine is a specialty that is a lot more of that approach in regards to looking at other organ systems and how they affect each other, and also looking more
Mhm.
of the natural cycles and also how each of these natural cycles, when you align with it, actually activate the innate processes that are inherent in our biological system. Natural meaning that it's more aligned, with with nature. Natural circles. Oh, I don't know
Mhm.
what, if maybe I said it wrong. What I'm talking about? Oh, natural cycles.
Cycles,
Oh,
yes. Oh
okay,
my god.
okay.
Yes.
Yes, so the natural cycles. A lot of the ancient traditions pretty much focus on this, like traditional medicine or traditional
Mhm.
Chinese medicine and the Ayurvedic
Mm.
medicine of the ancient India, and they talk
Yes.
about these cycles during the day in regards to our organ systems. Certain ones are turned on at specific times, and for example, when we're sleeping, so our there's specific systems that are not, or they're resting, and then
Mm.
and doing repair mechanisms, and then when we're awake, there's other systems that are activated. So it's
Yes.
aligning with that will optimize
Okay.
the functioning of each of these systems. But in our modern society, oftentimes we're disconnected with these cycles. For example, if you're working at night, right? You're pushing yourself and you're supposed to be sleeping and resting, but yet you have to force your body to do the opposite. So when you do
Mhm.
that, it causes a strain within our system, and it causes, after prolonged strain, that could definitely affect our ability to function optimally, and that results in the symptoms and diseases. So the concept is realigning with those natural cycles to optimize the
Mhm.
functioning and result, which will result in your health and well-being.
Is that possible? Because some jobs needed at night.
Yes, and that's
Uh,
exactly. And so
yeah.
I think, of course, that's in depending on your situation, you may not be able to change that. However, I think that knowing that, you can probably do other things that will support your
Okay.
body's ability to adapt to it. So,
Okay.
for example, if
Yeah.
you're somebody who works at night and you're really challenging your body in terms of having a different sleep wake cycle and whatnot, perhaps you can supplement with things like theanine and melatonin to try to help regulate your sleep wake cycles. And of course, if
Mm.
you're going to
Yes.
stress your body in that way, you want to decrease the amount of processed foods and sugars and caffeines that also affect those natural cycles. So it's just having awareness of what affects these natural cycles and what enhances and gets you back in these
Mhm.
cycles, that's really important for our clinicians as well as the clients that we work with.
What I noticed with all the resources we have, a lot of people don't know that. Like
Yes.
many physicians, they don't believe on that.
Yes. And I think there's many factors. And as being a physician and being on both sides, it's really interesting for me because one of the things I've learned from myself is this sense of self compassion. What I mean by that is that many physicians are conditioned, yeah, to work hard, to push, to
Yes.
will things to be. And that's where we find our value and to be
Yeah.
productive and to do things for others and other people. But what I've realized is when you don't have the balance, oftentimes that becomes a limiting factor for us, and it becomes a sort of a self-destructive process for us healthcare workers, is this concept of taking the time and having self-care and self-compassion and not pushing yourself to the point you yourself get sick.
I think that's another part where family and raising the way you raise your kids come up in the society because they feed you since you were young equal.
Yes.
We were created differently. No, those things makes you feel less if you don't do more in your field.
Yes. So it
Yeah.
you bring up a very important concept, and I think it's in part of that paper as well that I've shared with you, is this concept of harmony and balance. And so a
Yes.
lot of the spiritual traditions in the ancient healing arts talk about the concept of yin yang and masculine
Yes.
and feminine energy. And it's very important for us to understand that there are polarities and there's, again, polarities as well as cycles. But it's important that there needs to be homeostasis, that there needs to be
Yes.
a balance in both. And when you have predominantly one side, or if it's skewed, then that's where you start having suffering. That's when you start having symptoms and disease. So, what you were talking about is this concept of the masculine and feminine energy. And within all of us, whether you're a male or a female,
Yes.
we both
We have
have
both.
it. And so it's basically, when you look at it from the energetic and spiritual, it's a filter, I would say. So the masculine energy, what they would describe would be more of the will. It's the doing, it's the competition, it's the using the logic in the mind, and it's making things happen. Whereas the feminine energy is more of the nurturer, it's the
Hmm.
receiver, it's the creator, it's the non more of the emotional aspects. So when we have this balance, and granted, we talked about we all have both. However, sometimes it goes in cycles, right? Sometimes we
Yeah.
have to be assertive, we have to get things done. But if we're constantly on that shift level where we're always doing that, and we don't go to the other way where we receive and we do
Yes.
self-care and we ask for help, then we get into trouble. So it's
Balance now.
imbalance. So it's men and women. Our goal, if you want to achieve health and wellness, is really to have that balance. But the issue is, and the challenge is, in modern society, we are, like you said, we are conditioned early on as kids to be a
Yes.
certain way. That if we're male, yes, we're supposed to be the provider. We're supposed to be the stoic kind of person who doesn't show feelings.
Don't show your emotions.
Exactly.
Don't cry.
And when you think about it, and this is what I realized too, is that, oh my gosh, when we take that on and we're so restrictive and so limited in our thinking and our ability to feel, that's when we have problems. And when I
Yes.
started doing this work, I started to understand that I myself had a very restricted emotional bandwidth. That I started thinking, oh, do I really feel happy? Am I really feeling emotion and happiness? And because a lot of us, what we're taught is we don't want to feel those negative emotions. We don't want to be sad. We don't want to feel shame and guilt and so on. And so when we restrict on that side, what we're doing is we're also restricting on the opposite side. So what we feel is this very narrow bandwidth of emotions. And when I started doing this work, I was like blown away because some of the modalities, especially with the psychedelics, I was like, I have never felt this in my life in regards to feeling of happiness and bliss, but also feeling of intense fear, guilt, and shame. And you realize
Mm.
that our human life and really what the goal is for us to feel fully. And when we don't feel fully, what happens is there's blocks that happen in the energetic system. And it results in decrease in specific organ systems, and it basically distorts the information that's going to those areas, whether it's the immune system, endocrine system, or nervous system. And that ultimately results in sickness and all the diseases.
That remind me of something I heard Dr. Nader Batu
Yes.
said. He's a cardiologist, so he was like, trust me, there is like when someone comes to me with a blockage in an artery, if it's right or left, I would know. I would tell them if it's, let's say, if it's left, he has a broken heart, grief, someone died, or he's a breakup, like in a relationship. And every time he asked them, without knowing them, they would say yes.
Yes. Yes.
It's insane. It's insane. I wouldn't believe it 10 years ago.
Yeah.
Let's say 15 years ago. Yeah, I wouldn't believe it. But there is something in me that told me modern medicine is not complete.
Yes. And you hit,
So you mentioned
no,
psychedelics.
you hit on the dot. I think more and more of us are really having or aligning and becoming aware of what we call our intuition or an inner discernment.
Yes.
And that's where we're all being called to, because that inner discernment and that intuition is really tapping into that non-physical world. And if you want to explain it through the neuroscience, it's Dr. Stephen Porges's work with the polyvagal
Okay.
theory. And what he describes
Oh.
is this thing called neuroception, right? And neuroception is
Mhm.
basically our nervous system and is interacting with the energetic system, and it's receiving information. It's basically saying that
Okay.
our bodies and our nervous system, and especially our pineal gland, is a
Yes.
antenna. It's a processor of what's going on in our external environment, but also in that biofield, in that energetic field. And so it's able to sense and pick up information that's not in our traditional five senses in regards to feeling,
Mhm.
touch, sight, and taste, and hearing, and
Mhm.
all of that. So what it is the gestalt. It's that inner discernment, that knowing, that feeling you have in your body. And one of the things that's really been key for me myself is this cultivating that is, and it's interesting because I realized in medical school that I used it a lot because I remember studying for things and then I would do the tests and I would look at a question and I'm like, I don't think I've seen that anywhere.
Oh my God.
And so what do? I put my hand over the questions and I feel like which one seems right to me. And you know what? I've never failed the test.
My
And
God.
I think, oh my gosh, I use that all the time without me even, yeah,
Knowing.
knowing and realizing it. But that's what we need to cultivate. We need each of us to get in tune with that inner discernment, that feeling, and give validity to it. In medical school, I'm sure in your training too, is we're discouraged to do that. We're always
Yeah.
told, "Oh, don't do that because it's going to go to the wrong place." But it's
And detach from your feelings.
yes, but it's not
That's a big thing for me.
exactly. But the point is, you can't totally rely on that itself. Like I talked about
Yes.
before, it's both. You have to use your rational thinking, the evidence base, as well
Yes.
as your spiritual, energetic, and intuitive capabilities. So it's these two things in combination that's going to really change the way we see healthcare. So it's really key for all of us to understand that it's both things that are needed to optimize healing of the root cause, but also preventing, yeah, recurrency, and truly getting at what caused it at the first place.
That's very important point. Something came to my mind before I go to psychedelic. So y- me and you agree, like this has to be integrated with modern medicine. Like they have to work together. But nowadays, many people claim they know about energy, like fraud, let's say.
Yes.
And I think many of us, or like many of the population, many of physicians, are scared to come out and say, I believe in that, or I want to talk, I want to heal people this way, because we don't want the stigma of
Mm,
being fraud to the medical system.
yes. Yes. So this is,
We've seen a lot of people, they don't know anything about like energy, or let's say hypnotherapy, even
yeah.
psychotherapy.
Here's my thoughts on this. And it's, you're right, it's a challenge. It's interesting for me because one of my childhood wounds is this fear of judgment, especially,
Oh yeah,
yeah,
me
with
too. Yeah.
others, right? So for me to speak
Mm.
out on this, it took me a long time to even feel comfortable because I didn't want my colleagues to think I'm this wacky doctor who's went off the deep end and just doing this stuff that is woo woo and all of this. And yeah,
Yes,
you know what I'm saying?
we'll
Yes,
tell you.
exactly. However, what has really been apparent to me is that we as physicians and healthcare practitioners are so conditioned to give worth and validation to what they call, yeah, the science evidence base. But as I previously discussed, this is basically talking about the dense energy. It's the things that we
Mhm.
can actually measure. But we all know
There are a lot of metaphysics, and the thing we're talking about, energy, is evidence based.
there's more and
It's
more
just
now that are being able to validate some of these things now, especially in the quantum physics world. And there's also other developments. For example, I'm working with a company called, which
mhm.
is a company that makes this machine and equipment that can actually measure the energetics, is the
Biofield.
biofield, the auric system, and changes that happen there. So it's coming. And they have things like the Kirlian photography, where it
Mm.
measures the biofield and looks at changes when specific modalities are done. So there, it's coming there. But I think the most important thing for clinicians to understand in regards to this work is that what happens in that spiritual energetic, really you can measure it through the changes that occur in our life in regards to our lived life, our embodiment. How does it
Mm.
feel? What is the experience like? What are the changes that occur after certain modalities in healing? One of my thresholds, and for me, is when I go through a modality or treatment, if there is a shift in my emotional state, my internal state, I then I know that something happened. Okay.
Mm.
So a lot of
Yeah.
times, and probably from some of modalities and retreats that you've experienced, is that sometimes these emotions just come up out of the blue, right?
Yes.
And rationally, you have no clue what's going on, but your body tells you something happened.
Mm.
There is a change
Yeah.
within, and oftentimes you have to become attuned to that change, right? Sometimes
Mm.
it's this negative change where it alerts you that, oh my gosh, something I should be staying away from or afraid, or something you need to change. And that's this the clamminess, that sympathetic drive. And then when you go the other way, it's that parasympathetic, is you feel this calmness, you feel this internal
Yeah.
warmth, and this sense of, sometimes it's, when it's extreme it's bliss, but other times it's just this feeling of, yeah, calmness and peace. So when you're able to discern and really attune to those variations within yourself, then you become able to discern whether, one, is this coming from my left brain, my rational evidence
Mm.
and science evidence based brain, or is this coming from my right side of my brain, connected to that emotional state, that parasympathetic state. And so when you're able to discern that within yourself and put it in practice, it becomes a lot easier for you to make the right choices without being reactive, without just reacting, without thinking about, is this the best choice for you? Is this the highest? Is this for your highest good?
Yeah. Psychedelic.
Yes.
What got you into this path of
Oh
it?
my gosh, it's been a journey for me. But I would say back in 2016, I had this very intense experience at a place called Esalen. And it's a retreat center in Big Sur, California, and it's been around since the 60s. And it's famous
Mm,
people have been there, like Joseph Campbell, and then Timothy Leary, and Stanislav Grof, or all of those people that were in the self empowerment and improving your success and all of that. When I
mm,
did it, had this very intense experience of connecting with the spiritual as and my inner child. And I did this holotropic, what they call it, holotropic breath work. And it was this type of
mm.
breath work that gets you into this altered state of consciousness. And when I did that, I saw my little 5-year old self in the corner crying. And I was in distress and I was hopeless. And when that happened, all these emotions came out, but also I felt this intense energy going through me. It was like I had this electrical lightning go through the top of my head.
Wave.
Yeah, and go through my
Yeah.
body and down and out. And when I started exploring that, there was a practitioner there that did what they call the spiritual massage. And it was what I understand now was a shamanic session. And so when
Oh,
she finished with me, she goes, Nelson, you need to go see a shaman when you go back to Houston. And I was like, what's a shaman? What's that all about? And so when I came back to Houston, I started researching, of course, and I delved into shamanism. And this whole field of shamanism is wow, what is this? And it was all about understanding spirituality, the energetics, but also this whole thing about plant medicine and sacred medicine.
mm,
So the shamans use what they call sacraments, this plant medicine, to help people heal mind, body, spirit. And so to me, the psychedelics, I was like, what is this? And how does that help people heal? And I started delving into it. And within 6 months, I was in Peru working with a shaman. And
oh my
yeah,
God, 6 months.
yes, within 6 months,
It's so
I got
fast.
myself down there and I was there for 8 days. I had 4 ceremonies with ayahuasca. And wow.
Oh my God, you started with ayahuasca?
Yes. Okay, I've modified that. Did delve into a little bit of the psilocybin through another practitioner that helped me get into that space because it's a whole
Mm,
different world.
yeah.
And your nervous system has to get used to it because, and this is one of the things I'm very interested in, is how do we help people, prepare people for the optimal experience in psychedelics. But I can tell you that I can truly say two of my most challenging and intense nights and days of my life were during psychedelic ceremonies because it really pushed me to the threshold where I was
Mm.
really delving into those deep seated subconscious emotions and events. And it allowed,
And we don't want that.
yeah,
We try to block
that's the thing, right? It's a
yeah.
lot of people. They friends tell me that all the time. They're like, Nelson, why would you want that? Why would you seek that? And I would tell them what you begin to realize, especially in the newer literature and the trauma literature and the trauma based work, is that when you're able to bring up these deep seated emotions and be able to process it and release it, it
Mm,
optimize it removes the blocks like we were talking about before with the energetics and allows
mm,
optimal flow within our energetic system, the meridians and the chakra systems, in order for us to achieve true health and wellness. So you have to go through that intense purge, like especially with ayahuasca, it's releasing, it's removing. So it's releasing physically because you vomit through the ayahuasca. So you're removing
No,
toxins.
I'm so scared of that.
Yeah, but see, that's why it's important, like especially somebody like you, to work with a team to prepare you for it so you can actually be able to surrender. So that's one of the things I'm working on, is
Yeah.
developing a team approach, this network of practitioners that would actually guide people through this process in order for them to be able to completely receive and surrender to it. So it's I think it's going to be the wave of the future, is this needs to be part of our healing paradigm, is this concept of healing the psychoenergetics.
So, where do you like, as a physician who was like your whole life working in the US, why do you think they didn't integrate that as a medicine in like in the healthcare
Hmm.
system?
You don't want to get me into trouble.
No, no, no. I'm. It's just out of curiosity.
Sure.
Like, even like I'm talking. Let's say I'll talk about internationally.
Yeah.
We push to provide it to
Yes.
people.
Yes.
That's what we learn about. Yeah.
Yeah, and I think that's a very complex question, and very, how would you say it? You have to be extra careful because, as we know, a lot of things in our world is based on finances and money. So I think that's a big factor, right? We have these industries of the pharmaceuticals and the hospitals
Oh
and
yeah.
a lot of our institutions, whether it's the educational system and the medical system. And so when you have something like the herbal medicine, the plant medicine, a
Mm.
lot of this is natural medicine. So it can't be, you can't have,
Made.
yeah, a lot of times you can't make money out of that. And it's not as fruitful as, say, pharmaceuticals. So these kind of modalities are not really supported or encouraged financially, but also by the systems. Because the other
Mm.
thing is that when you look at what it does, it's trying to heal the root cause. So if you heal the root cause, what happens? It's the person you're working with actually may not need the treatment that you are giving for indefinitely. So that means that
Yeah.
you're not going to need the drugs, you're not going to need these other things. So that means that's going to affect the ability for these businesses and these systems to make money. So I think that's another way. And really the other factor that I believe is that as a society, we are conditioned, especially the Western society in the United States and so on, is that our focus is to be in that evidence based, that dense energy, the physical world. And we
Mm.
are not really accustomed or comfortable in that metaphysical or spiritual energetic world. So there's those are, I think, the major factors that affect why these things are not in place.
So
I know you're frustrated.
being yeah, I'm frustrated, but being in the medical field, I remember telling my dad after my first year in training, medicine become commercial and it lost the core value of why it's medicine. And I don't feel I belong.
Yeah. I think a lot of us are feeling that, right? We've talked about this before, is that we as
Yeah.
physicians, most of us, I think, have come to it with the perspective of we want to help people, that we
Yes.
want to make people's lives better. And then we're in this present situation where a lot of us are realizing that maybe we're not making people better. Maybe
Better.
we
Yeah.
are just treating the symptom and just giving him the medications and not really helping him with the other things. So I,
And it's not just that, like the ethics we learn at school is not being practiced or applied fully by physicians in the hospitals and the system. Let's say there is a patient who came to you, you're a surgeon, and they want to do a bypass, and they are like 65 kilogram. Many of the physicians would say, yeah, I'll do that for you. But ethically, you can't do that.
yeah, and that's truly why I think a lot of us are getting out of it. Me personally, when I was
Mm.
working, I felt this, what we talk about in ethics is moral injury. And this moral injury meaning that I felt like I was forced to do things that I knew deep inside that may not be optimal. But
Yeah.
because I had to maintain my practice, I had to follow the standard of care and what the insurance paid, I did it. And
Yeah, because the system wants you to do it. If you don't do it, you're like,
exactly.
you might be homeless.
Yeah, you,
Yeah.
in one, you won't get paid because you had to do these
Yes.
specific things. And secondly, yeah, you may be medical liability wise, you may be sued,
Yeah.
and
Hmm.
thirdly, your colleagues and people would say you're not following standard of care, therefore you're not a good clinician, and so on. So there's so
Yeah.
many barriers for clinicians at this time practicing in regards to really tuning into that inner discernment of what truly is going to help the people that we're working with. And it's not saying that the things we're doing is not of any benefit. It is, especially in acute care, right? If you're taking care of somebody who has acute hypertension or an acute infection or a trauma, you need to do that at that point. But the problem is
Mm.
when we're talking about chronic conditions and the cardiovascular issues that we have, autoimmune issues, the cancers, a lot of those things stem from this other realm of the root causes being in the psychospiritual domain. And we're only
Yeah,
focusing on the physical, but both need to be addressed.
that's true. So I want to do rapid fire questions. Like I'll ask you a question, just quick
Sure.
answer. Okay. If a practitioner could only add one element of his framework to a standard 15 minutes checkup, what should it be?
I would say the most important is to take a period of time where you take some deep breath into stillness
Mm.
to get out of that fight flight to be able to connect with the person you're working with.
That's nice. In 10 years, will biofield assessment be as common as blood pressure, cuff, let's
I
say?
believe so. There's so many different products and equipment that's being created right now that I think it's with more training and awareness that it's going to be more accepted in general.
Another question. What is the primary blocker to to this paradigm? Lack of data, insurance reimbursement, or practitioner ego?
Ooh.
The
All of the above,
major
all of
thing.
the above. But truly, I
All,
think is really we have to dismantle this whole system of the reimbursement and this whole financial basis of what we're doing. I think that's the biggest one.
okay. So, in 3 words or less, what is a whole person healing means to you?
Balance, yeah,
Okay.
balance is one. I would say
Uh-huh.
authenticity is
Mm-hmm.
another, and the other is sort of peace, is sensing that calmness and peace within. So if we have those three
Mhm.
things, I believe
Beautiful.
that we can achieve health and wellness and wholeness.
Okay. So, the last question is which of the four realms, physical, emotional, spiritual, mental, do you find most challenging to maintain your own life?
I would say, in general, in my own life, and this changed, right?
Yeah.
Because to me, initially, a lot of it is was the spiritual. Because as we
Mm.
discussed before, a lot of us have that spiritual disconnection because we're so busy.
Yeah.
But I would say, since I've been doing this work, that's been a lot easier for me. And the other thing is changing our mental, our limiting beliefs.
Oh,
Yeah,
yeah.
well, so many of
Yeah.
us have these ingrained, this very,
Fed to
yeah,
them.
focus
Yes.
and limiting beliefs and things like this is one of my pet peeves, right? Is that many of our colleagues say this is woo woo, there's no evidence
Yes.
base, and but when you start looking at the metaphysical and the quantum physics and whatnot, a big factor is our belief system. And we know
Yes.
this from the placebo and nocebo effect. So, if our system is so powerful that by saying that this will work, why wouldn't you? want to believe that way? Why would you want
Yeah.
to tell yourself that this is not going to work? And why ethically would we say that to our patients and limit their ability to heal?
And most of those practices don't harm you. If it didn't benefit the person, it will never harm them, like the spiritual connection, the breathing. So why not?
Exactly. So I had three questions every time I think about a modality or treatment. I would ask one, does it help some people? If it does, then, like you said, why not?
You're breaking up.
And secondly, does it harm some people? Is there side effects that would cause
Yeah.
damage or injury? And thirdly,
Mhm.
would it be accessible? Would it be something that we could
Yes.
implement? So a lot of the things we have here at Golden Hill is my retreat center is
Mhm.
those three things. If those three things is a yes, then yes, absolutely. Let's try it. Whether it's the tachyon energy chamber, whether it's a vibroacoustic therapy, whether it's a right frequency machine, whether it's a brain tap that has the binaural beats and so on, and or aromatic therapy. All of those things combined can really help reset the nervous system and activate our own innate healer. So that's our mission here at Golden Hill is to activate your innate healing.
So you mentioned the retreat, the center. Can you mention briefly what kind of retreats you hold and how many? Is it weekly? Is it, and where can people find the information?
Yes. So that has been put in my heart is after I basically removed or decreased my medical practice, I had this spiritual message that I was supposed to create this retreat center where I can incorporate some of these complementary alternative healing methods. And so we have a website, it's goldenhillretreat.com, and we also have a Facebook page called Golden Hill Retreat Center, and we have all of our different events and workshops listed there. And it's throughout the year, we have everything from energy medicine to Ayurvedic retreats to sacred ceremonies and other offerings that people can attend and experience it. And we have one coming up actually for healthcare professionals. It's on
Yeah.
February
Yeah.
7th, and it's a day retreat where we're going over the neuroscience, some of the things that I've discovered about these ancient practices, and then being able to experience these ancient practices like meditation, yoga, mudras, vocal toning, and ceremony. So I'm really excited to introduce this to clinicians and to really open up the hearts and the minds of our colleagues so that we can all not only have healing within for ourselves, but help our clients and our patients heal as well.
Thank you. Thank you, Dr. Nelson. As we've discussed today, the integrative healthcare isn't just a theoretical exercise. It's for a society facing a crisis of chronic illness and burnout. So, moving from a reductionist model to a whole person model require more than just new tools. It require collaborative from the system, the physician, and thank you for all the information. I enjoyed reading the white paper and I was like, you should publish
Yes,
it.
I'm going to work on and focusing on these areas because truly, like we talked about, it's going to be the integration of all of this that's going to
Yeah.
change our healthcare system. So I'm excited
Yeah.
to get people in the network and to collaborate together and to explore and create. So thank you for sharing this information. And I'm excited to
Thank you.
collaborate with Physician Transformation Institute and have these workshops and opportunities.
We have a lot to
Yeah.
do with you.
So thank you.
Yes. Thank you. I'll see you next
Okay,
week.
let's see you next week.
Yeah. Have a
Okay,
great day.
thanks.
Bye bye.
Okay, bye bye.